PA005, Healthcare Program Policy Evaluation Summative Assessment NURS 5050, Policy and Advocacy for Improving Population Health. PA005, Summative Assessment Overview. For this performance task assessment, you will select a Population Health Program Policy Evaluation that has been completed and assess the outcomes of the Population Health Program Policy Evaluation. Your response to this assessment should reflect the criteria provided in the rubric. Adhere to the required assignment length. This assessment requires submission of 1 files, a completed Population Health Program Policy Evaluation Analysis. Save the file as PA005 Analysis, first initial last name. You may submit a draft of your assignment to the Turnitin Draft Check area to check for authenticity. When you are ready to upload your completed assessment, use the Assessment tab on the top navigation menu. Instructions. Access the following to complete this assessment. Population Health Program Policy Evaluation Analysis Template. Before submitting your assessment, carefully review the rubric. This is the same rubric the assessor will use to evaluate your submission, and it provides detailed criteria describing how to achieve or master the competency. Many students find that understanding the requirements of the assessment and the rubric criteria help them direct their focus and use their time most productively. Research and select a Population Health Program Policy Evaluation report that has been completed and shared. Based on the Population Health Program Policy Evaluation you selected, address the following in the Population Health Program Policy Analysis Template. Describe the Population Health Program Policy outcomes. Explain how the success of the Population Health Program Policy was measured in the evaluation. Identify how many people were reached by the Population Health Program Policy based on the Population Health Program Policy Evaluation you selected. Describe at what point the Population Health Program Policy Evaluation occurred. Describe the sources of data that were used to conduct the Population Health Program Policy Evaluation. Explain at least one potential added benefit and one potential unintended consequence of the Population Health Program Policy based on the results of the Population Health Program Policy Evaluation. Be specific and provide examples. Explain which stakeholders were approached or involved in conducting the Population Health Program Policy Evaluation. Which stakeholder would benefit most from the results and reporting of the program policy evaluation that was conducted? Be specific and provide examples. Explain whether the Population Health Program Policy successfully met the original intent of the outcomes that were identified. Was the Population Program Policy successful? Why or why not? Explain whether you would recommend continuing or implementing this Population Health Program Policy. Be specific and provide examples. Describe at least 2 ways that you, as a nurse advocate, could become involved in evaluating this Population Health Program Policy after 1 year of implementation. Be specific and provide examples. Please contact Nursing Assignments Pro for help with PA005. Healthcare Program Policy Evaluation Summative Assessment NURS 5050, Policy and Advocacy for Improving Population Health, or any other assignment. Email nursingassignmentsprofessor@gmail.com.